Let's talk about exams, medical board exams. With Dr. Kwafu, hey.
Hello viewers, welcome back to the medical board exam experience with Dr. Kwafu. Today we have Dr. Alade Ayodeji, a Nigerian who had her medical education in Karazin Kharkiv National University in Ukraine. After his studies, he went back to Nigeria to prepare for the Nigerian Medical and Dental Council board exams. He sat for the exam the first time, he failed. The second time he failed. Third time he failed, and he finally passed on the fourth attempt. Today he has joined us to share with us some of the mistakes he did that led to his many attempts and how he came back stronger to prepare and pass on the fourth attempt. Let us join Dr. Alade in our discussion. Thank you. Viewers, on this channel I interview doctors who have successfully passed or failed any medical board exams to share their exams preparation experience with us and with all those preparing to write theirs. If you are watching me and you have experience in any medical board exams and would like to share with us, kindly contact me on my Facebook page, Instagram, or leave a comment at the comment section of this video and I'll keep in touch. Please do not forget to subscribe to this channel and recommend this channel to any medical student or medical doctor who is preparing to write the board exams of any country. Thank you. Okay, so my first question is, for those who are not familiar with the Nigeria board exams, who is qualified to take the Nigeria Medical Council board exams?
Okay, thank you, Dr. Kwafo. I want to thank you very much for the privilege, and it's been an honor. I really appreciate that. To answer your question, Nigeria board exams are for Nigerians and non-Nigerians. Nigerians that school abroad that want to come back to the country to practice medicine, or non-Nigerians that are either schooling abroad and they want to come and practice in Nigeria. So you need a Nigerian license to be able to do that. So to answer your questions, those are qualified to write the exams. They are the Nigerian medical students that finished from either countries like Ukraine, Russia, China, everywhere. After the completion of their medical school, they want to come back to Nigeria and work as a doctor in the country. So you need a licensing exam to be able to do that, which is Nigeria Medical and Dental Council exam.
Okay, so the exam is conducted in how many languages?
Okay, the exam is purely in English.
Only English. And you can take it only in Nigeria, or you can take it in any other country?
It can only be taken in Nigeria, since it's a Nigeria medical exams. Yes.
Oh, okay. And the exam is in how many parts? Is it just a one-time exams, or you have to take part 1, part 2? How is it like?
Okay, the way the exam is being structured is that the exam is a 2-day exam. The first day comprises of the multiple choice question, and the second day comprises of the objective structure exam, which we call the OSCE. So the multiple choice question, all in all, is a computer-based exam. What they do is that they will partner with a teaching hospital here in Nigeria. So after partnering with them, or maybe a university in Nigeria, they will partner with them. The medical council will partner with them. So it's the school that will be in charge of organizing and conducting the exam. So the CBT exam will be done in the hall of the school they partner with. So it's a 2-day exam. The first day is the multiple choice question, and the second day is the OSCE. The multiple choice question comprises of questions from the 4 basic specialties in medicine. That's pediatrics, gynecology and obstetrics, surgery, and medicine. Then, so the computer-based exam, we have the picture test, and we also have the multiple choice question. The picture test is such a way that is okay. All in all, there are 300. So the MCQ is 250, while we have a 50 picture test. The MCQ are basic knowledges in all the 4 basic specialties in medicine, while the picture test is like they will give you a picture. A picture will be projected to you, and you are meant to answer the question under that picture. So sometimes the picture can be a straightforward question. Okay, what is this? Identify this. Or maybe they will tell you, what is this picture? What is it used for? They're going to bring out a question from you, from the picture they presented to you. So it's a 3 hour based exam, which you do on the first day. It's a computer based exam. It has got 350 question, 300 questions in all, 250 MCQs, and 50 picture tests. So, and it's 3 hours. After doing that for the first day, you're going to go to the hospital setting for the second day, which is the OSCE. OSCE, we have about 11 tables. So, different questions on each table with one recitation. So it's time based also. You are expected to sit. There will be a lecturer or an examiner on the table. There will be a question for you to answer. So once the bell goes off, we're going to change from one table to another table. And also for the objective questions, over the years, the exam has taken a format in such a way that at the end of the day, you could easily predict maybe what is going to come out. They always have a section for physical examination. They will put a patient for you. So they'll ask you to do either respiratory examination, cardiovascular exam, just examination. Other table, there could be question under public health. Other table, there could be a question whereby they ask you to take an history from your patient. Maybe somebody presented with coughing and weight loss. So you are meant to take the history from that patient. So all in all, you have 10, 11 tables, one rest station, and 10 tables you are meant to go through under 5 minutes. So they have different questions for them. We have public health, we have physical examination, we have counseling, we have clerking, and some other things too. So that's how the exam goes.
Okay. So let's come back to the MCQs. So the MCQs, there's nothing like the basics. It's only the surgery, internal medicine, pediatrics, nothing like biochemistry or anatomy, right?
Yeah, there are a little bit of that. There are a little bit of pharmacology, a little bit of psychiatry, a little bit of public health. They chip in everything together. But all in all, they design the whole 250 questions in such a way that the majority of the whole thing are the specialty in medicine. Every other little thing that comes in are either pharmacology, psychology, psychiatry, and some other things too. They have a little bit of that in the questions.
The picture part, is it a picture like a pathology slide or surgery equipment? What are some of the pictures?
Okay, okay, for the pictures now, for the pictures, we have a variety of pictures that comes for the picture test, which is the part of the first day on the CBT. For my last exam, which I took, I saw pictures from gynecology, that's instrumentation. I saw pictures from surgeries. He also gave me instrument too. I saw instruments like sphygmanometer, and there are also films, X-ray films. We have a slide, it's pathology slide, yeah. So they just go randomly and pick everything together, basically. So pictures from medicine, pictures from surgery. We have pathology slides. It could be something of Burkitt lymphoma. There could be something on a sickle cell, how to identify it on the slide. So gone are the days where they used to give us a direct question. But these days, what we have is that they will give you a picture, but they won't give you a question like, what is this? Identify this. No. What is going to come under those pictures are applied questions that you have to think about it before you answer them.
Okay. So, per your experience, now they said the exams is divided into three parts: the MCQs, the picture part, and the OSCE. Which part is very, very demanding?
Uh, as for me personally, the part that was demanding for me was the MCQ. Because before you go in for the OSCE part, as I've said earlier, the OSCE is structured in such a way that there are things that comes out every time they are doing the exams. So you know where you can focus on. Things like physical examination will come out. You would definitely do an examination. It might be an abdominal examination. It might be a cardiovascular examination. Things like public health will come out. Maybe in this last exam that we took, we had a question on coronavirus. Okay, what are the causes of coronavirus? How can it be treated? What are the precautionary measures? What are the things you have to do to avoid getting that? You understand? So the OSCE is taking a format that know how. Every time the exam is being conducted, there are things that comes out. But the MCQ, you have to have a vast knowledge in either pediatrics, medicine, obstetrics and gynecology, and surgery. There are questions that are not straightforward, although they are the things we've learned in medical schools, basically. but you just have to read far and wide. However, there are some books, like summary books, that people have been doing just to guide you or to introduce you to the Nigeria system. Every medical school over the world has got their own system how they train their medical students. But there's one thing that connects all of us. O&G in Nigeria is the same O&G they are doing in Russia. O&G in China is the same thing they are doing in Pakistan, basically. But every environment has got its own peculiarities. Like while I was in Ukraine, there was something like malaria. Although while I was taking infectious diseases, they took us a little bit of that. But we don't have that. So when it comes down to this environment, they have got a lot of peculiarities that you just have to have at your fingertip because you are coming to practice in this system. So you have to get yourself accustomed and acclimatized to the whole system so as to be able to deal with their patients.
Okay. So what are some of the recommended books that available for students to prepare?
Okay. As I've said earlier, that the Medical and Dental Council is like a body that regulates the practice of medicine in Nigeria. So what it does is that they partner with every university or medical school in Nigeria, and in such a way that they will tell you before you come for the exam, you have to. Okay, before the body used to conduct like a training section for people, whereby everybody that is intending to write the exam, they will partner with the university. So all the lecturers at that university will be teaching them and preparing them towards that exam. But at a point in time, they had a problem with people in such a way that a lot of people failed the exam and the whole thing escalated. So ever since then, MDCN as a body has told anybody that want to write his own qualifying exam that you have to go and get yourself accustomed to the Nigeria system. You can do that either by going to a teaching hospital to learn, maybe for a few months before the exam, or there are tutorial centers that are designed in such a way that they teach you and prepare you towards the exam. Or it will be a personal thing in such a way that there will be a good discussion between you and your friends that you be tailored towards preparing for the exam. So in answering your questions, there are books that are being designed by Nigeria Medical School that encompasses how they do medicine in Nigeria, basically. The books, they call the book, there's a book they call The Guide. The guide is designed by the Medical School of University of Ilorin here in Nigeria. There's a university like that, UITH. They are the one that designed the book. So there are also books like Synopsis, like Precise, like All Round World Round. Yeah, there are very good books like that. That is their medical school that prepared those books that introduces somebody on how the medical thing is being run in this environment. So they're like summary book instead of you going through big textbooks. We've gone through that in medical school. So all those books are being designed like a summary, a fingertip summary that introduces you to basic things you need to know. So instead of me reading 4 or 5 pages of hypertension in a bigger textbook, that textbook and that small book might have just a page or 2 pages on hypertension and the basic things I need to know in the Nigeria system. So we have books like The Guide. We have book like Precise. It's been designed by medical school here. We have books like All Round World Round. Yeah, it's a very good book. We have books like Synopsis. They are just been designed a summary book by Nigeria Medical School students so as to enable anybody.
During you are preparing, are there some past questions that you use to assess yourself before the main exams?
Yes, there were a lot of past questions. There were a lot of past questions, but all in all, the aim of past question is, I think, it's something that counts like a month or 2 months to the main exam. The main thing that counts is for you to have the basic information in your head. Anybody that is willing to answer past questions, the council doesn't have a question bank for you to prepare with. No, just see this one will come. Okay, I have a question in O&G. Let's solve. You see this one will come. I have a question in surgery. You see another person will come. I have a question in psychiatry, basically. So it's not a situation whereby they have a question bank that will have to go. It's not like PLAB or USMLE that there are things like PLAPable, things like that we have to go through. No, we don't have something like that. All the demand for you just for you to go and get prepared I don't know how they want us to do that because they used to do tutorial for us before, but now it's cancelled. So all to answer your question, there's no question bank. It's just individual question banks that comes from either tutorial centers or maybe while you are reading, you browse online and you see some questions you want to go through. That's the first question that they have. But as far as MBCN is concerned, we don't have any question bank for you to prepare with.
Okay. So how long take you for this?
Okay. The okay. One thing I would like to say is that while I was preparing for the exam, I take some time off to like maybe 3 or 4 hours or 5 hours in a day. I just go through the whole thing over and over again. I it's been a while. I've been attempting to do this exam. This is like my third or fourth attempt of doing this exam. And when I came in, and that's one thing I want to say. If I would advise anybody that wants to do this exam, don't just come in and rush because people are doing it. No, you have to come into the system. You have to settle into the system gradually. There are some things that they do in this system that you don't have the idea of how they do it. And those are the simple things that will come in your exams. So if you are doing it because people are doing it or you just finished from somewhere, maybe the UK or maybe Russia, you came back to Nigeria and you saw your friends applying for the exam, you also applied for it too. In my own case, that was what happened to me. I didn't really have a very solid background of how the system was going. I just had to do the exam because that was the exam we needed to do to qualify as a doctor or to practice as a doctor in Nigeria. So I never had the glimpse, I never had the grasp of the basic things I need to know. So when I got to the exam halls, they were not coming up with those simple things, and it was difficult for me. So that was why I had to do the exam the first time. I took it back again the second time. I took it back the third time. So and I was now perplexed that what is really the problem? Why am I getting this? Why am I getting this thing wrong? I have my colleagues, I have my friend that does this exam on one attempt and they clear it off. So later I sat down and I got to realize the fact that what was giving me problem this exam was MCQ basically. There are ways they hacks the MCQs that you have to know. They will be asking a question like all of the following are this except this, all of the following are not correct, but with this are, there's a way, the logical way they ask that question that if you are not very careful, you get the whole thing wrong. And we don't have anything like negative marking, no. It's just mark you on whatever it is you have. But what I'm saying is that don't do things because people are doing it or you just want to rush into it. No, you're going to get it wrong. There are ways things operate, and if you want to do well in that system, you just have to understand how you operate. So coming back to your question, my preparation was 3 or 4 hours in a day, and I made sure I stood to it. My first attempt, I got accustomed to teaching hospital, so I was going to the teaching hospital to know how their system is being designed. So that was the whole thing I did for like 3 months before the exam. I will leave my house, I'll go to teaching hospital, I will see their consultants, their senior doctors whenever they are having a ward round. I will join them and I'll be able to go through whatever they are doing. So at that, the exam didn't come out fine for me. I had to stop going to the teaching hospital. On the second attempt, what I did was there are tutorial centers that are being designed for people that want to take this exam. So what it means is that anybody that will be a tutor in that center, there are people that have done this exam before, which is the NBCM exam. They will be the one teaching you, okay, this is what you see. In case you see this, this is what you do. In case you come across this, is how you're gonna do it. So that was what I was doing. At that point in the second attempt, I didn't go to teaching hospital. I was attending a tutorial center. I felt okay, let me try another perspective of approaching this. Let me see people that have done this before, if they could light my way up for me and tell me how to go about it. That didn't come out true for that didn't come out successful for me too. So the other attempt it was me and some couple of friends that have done this exam over and over again. So we sat down, we are not the one coaching and teaching ourselves. So what we do basically is, as for me, I had like two different friends that were in a different city from me. I'll call them on WhatsApp call every day, since we knew that MCQ was one giving us problem, so we kept on solving as many MCQs every day. When I call them on WhatsApp call, maybe 1 hour, maybe 2 hours or 30 minutes. When we are free, we'll do that one. So personally, I sat down on my own. I didn't go to teaching hospital. I didn't attend any tutorial center. I was just studying on my own. So the extra thing I added was me making calls on WhatsApp calls with my friend who was solving MCQ, and that was how I went through the whole thing.
What about so that was how you went through to pass finally, right?
Yes, that was what I did to pass finally. I didn't go to any teaching hospital for any attachment there. I didn't attend any tutorial center. All what I did was I was doing a personal reading, maybe 3 or 4 hours every day, and I made sure I stick to that. Then most of my friends that have done this exam too, or maybe 1 or 2 attempts, like three of us, we came together. So since we identified the problem for the exam was our MCQ, we started putting ourselves every day on WhatsApp and we were doing MCQs every day, MCQs every
Okay.
day, and
So you are to prepare for this exam. What that will make you pass on the first attempt?
okay. If you are to prepare for this exam, what from the experience I've had, the basics is that you have to come into the system. You have to get a Nigerian book. Since you're praying for Nigeria exams, you have to go through it. Secondly, you have to meet people that have done this before, either on the first attempt or maybe 1 or 2 times before. So they'll be able to tell you how to do it. If you just say you want to come to Nigeria and just read and apply, fine, you might be lucky, but I wouldn't advise that for anybody. From my experience now, anybody that wants to take this qualifying exam, what I would tell them is that whenever it is you reach Nigeria, look for any tutorial centers. The tutors in those centers are people that have done this exam before. The exam will tell you what it requires and what you need to know. And once you
Uh,
know that, you don't have a problem in passing this exam. Okay.
what mark do you need to get to pass the exams? Like, is
Okay,
it
okay.
50?
Said Okay, yeah, yes. As I've said earlier, the exam is a 2 day exam. The first day is a CBT computer based test that you do your MCQ, while the other day is a OSCE exam. So they divide exam into practical and objective. So what you need to do is to have a 50 in practical and have a 50 in objective. Once you have 50 at both, you are good to go. Position whereby you have maybe 49 in your objective and you have 51 in, no, you are not going. You need an average of 50 at both practical and average of 50 at theory to be able to scale through.
Okay. So now, what's next for you after passing the exams? What's next?
Okay, after passing the exam, maybe 2 or 3, it used to be like a week after the exam, they will come out with a pass list of those that passed the exam. So what they normally do after your pass list is that they will do an induction for you, where it's like an oath taking ceremony, where you will
Mm.
now be welcomed formally into the system. You are going to get your temporary license. That's what we call it. They'll give you a temporary license. Then you're going to use that to look for your placement for housemanship or for internship. So the internship is a 1 year thing that you have to go through the 4 basic specialty in medicine. You are going to be working under supervision, and there will also be a little incentive for that too. So after finishing that 1 year supervision training, then you are now entitled to apply for your permanent license. But upon passing the exam, there will be like an induction ceremony. After the induction ceremony, they will give you a temporary license in which you use to go and look for your placement for your internship, working under supervision for a year. And
During the
after that,
internship, do they how much do they pay the interns? How much
okay, what a pay interns about maybe $500, maybe $500 thereabouts. Five hundred
uh,
dollars there, yeah, every
eh,
month. Yeah, it all depends on where you do it. We have a teaching hospital, we have a state hospital, we also have federal medical centers. So it depends on, but the pay is not really. There are just little discrepancies about the pay. But average of maybe $500, $600 per month. That's what the pay is.
okay. And do you have a choice? Can you choose where you want to have it?
Obviously, obviously. Housemanship is not something to anywhere you want to do it. All you do is just to build up your curriculum vitae, that's your CV, your medical school degree, your medical license after the induction. You put everything together, and whenever there's an advertisement for interns at any available institution, you express interest in joining them. And once you are taken, they'll do interview for you and you can start working.
Okay. So how much does it cost to register for the exams? Registration fee.
Okay. Do you mean in dollars or in Nigeria currency?
Um, Dollars and Nigeria currency.
Okay. For registration for the exams, the exam has asked it happens in two phases. After your medical certificate from your school, you have to verify your certificate by what we call EPIC. Is like a body that verifies medical doctor results. So it's a platform you log on to. You're going to scan your medical result there, and those body will verify your result. So before you can do your MDCN registration, you first of all have to do EPIC registration. So you just go online, you upload your certificate there. The money you pay for the certificate you are uploading there. So once those people confirm your certificate, they will now send a letter to MBCN that this medical school is recognized, is accredited, and the certificate is genuine. So that's the only time you now have time to be able to register for the MDCN exam. Without your LPIC registration, EPIC is the one that will send a confirmatory email to MDCN to tell them that you are preparing for that they verify your result and your result is okay. So for the registration of the exam now, about $300, yes, about $300 for registration of the exams. So once the EPIC has verified your result, they will send an email to Nigeria Medical Data Council that this medical school is accredited, this medical degree is accredited. Whatever they want to do, you can do it. So you now have to do another registration with MDCN, and it costs about $300 to be able to do that.
Okay. Okay. So is there a special way for non-Nigerians who want to practice there, or they all follow the same process?
Yeah, obviously, it's just a little bit of maybe while a Nigerian is paying 300, a foreigner will be paying about $400. So, as I said earlier, the exam is for both Nigerians and non-Nigerians. There are people that have their degree in UK or maybe Canada, and they'll probably like to come to Nigeria to work. So you can't just say you want to come in like that. You have to do an exam to do that. So while in Nigeria we're paying $300, the foreigner will be paying 400 for the registration.
Okay. Okay. So for medical
Verifying.
students, for medical for medical students who are in school now and they are hoping
Okay.
to come back to Nigeria to write the Nigerian Medical Board exams, what advice do you
Okay.
have for
Okay, the advice I will have for them is that they should prepare for their final exams in school. While doing that, they should get accustomed to all these summary books, which I've said earlier, that is designed by Nigeria Medical School. Books like the guide, books like precise, books like synopsis. They should get soft copies of that, so that they will, while they are preparing for their school's exam and preparing to finish their medical school, since they are coming to Nigeria to practice, the earlier the better. Once they get used to those books and we have online access to those books. There are free copies of that and they can get online. So alongside the preparation in school on completion, they should also get those books and be reading alongside too, so that when they come back, it will be easier for them to be able to get accustomed to, and they will do the exam in one attempt and they just clear it off. Okay, Dr. Kwafo, the last thing I would like to say is that everything in life we are doing, there's a process for it. You have to understand the process. You just don't do this because people are doing it. In my own story, in my own case, whatever happens was that I didn't really understand what was going on. I felt I could just come in, read a little book, and understand there are processes to be followed in life. Life is not something that you just do it because you feel you want to do it, or maybe it's time for you to do it. No, there's progress. There are steps you have to follow. You have to understand how everything works. If you want to go to Canada now, there are doctors there. There are way to do things there. You just have to understand. If you want to go to maybe USA or the United Kingdom, there are way things are being done. So my final advice for anybody that's willing to take the exam is that please and please, you have to understand how they run their medicine here. There are things you have to have at your fingertip. That if you don't get yourself accustomed to those things, passing the exam actually be difficult.
Okay. Thank you very much, Doctor, for your time. I
Okay,
posted.
thank you, Dr. Parker. Thank you for having me, and I really appreciate. Another thing I want to emphasize is prayer. Everything you have to do in life, you have to involve God. It's not by power, but by the grace of God. So, the lighter notes, as far as you are preparing, you are reading, you are joining a study group, you are preparing, and you have it in mind that you want to take the exam. The God too has to work in the whole thing. You have to involve him in whatever it is you are doing. So, thank you for
Okay.
having me. It's a privilege, and I really appreciate it. Thank you very much.
Yeah.